Dr. Peters, thanks so much for coming by and spending time talking with me about your solution around mental health. So I understand that you've created a tech-forward way of assessing mental health. Can you tell me more about that?
Yeah, I'd love to. So at Rose Health, what we've created is the easiest way to think of it is that it's a remote behavioral health integration solution. So as you mentioned, starting with technology, we've created a way that primary care providers can really be part of the mental health solution in this country. We bring to them a patient-facing mobile application and a clinician-facing dashboard, allowing them to really review weeks worth of mental health data within a matter of minutes. But we do that in a way that also brings a human component to it as well, bringing a behavioral health specialist that can help integrate with their team and allow them to bill for behavioral health integration CPT codes.
Excellent. Well, it is no secret that mental health and physical health are closely aligned. It's also increasingly the case where healthcare providers are just overwhelmed with the amount of work they have to do. So it sounds like some of the resistance you might get is that I don't even have time to look after the physical aspects of a person's being, much less now try to take into account their mental health. So how does automation, or how do you sort of combat that objection or concern from the people that you want to have participate and engage in this important aspect?
Yeah, and thank you for asking that question. We obviously run into that when we go out into PCP offices. I mean, automation is an essential part of it. PCPs are very interested in helping their patients in whatever way that they can, but they are very strapped for time, and as you mentioned, they are managing multiple conditions in these individuals. What we bring to them is they oftentimes are already doing some sort of behavioral health screening, whether it's a PHQ-9 or a GAD-7, but then they receive that data and there's really no direction on what to do with it. You know, they'll direct the patient to call the back of their insurance card. They're not doing anything wrong, they're doing the best that they can, but that process fails and the people never get the care that they need, which then leads to a decompensation in their other chronic medical conditions. So PCPs are very smart people. They understand that this is essential. We bring in automation, helping them to use that data that's collected from those initial screens. Our patient-facing application also does daily check-ins with the patient. It allows them to journal. We're building out other early indicators of mental health decline to really allow them to identify these people efficiently and effectively. And as you mentioned, even with that, they don't necessarily have the time to be taking care of these patients. So we bring with our offering a behavioral health specialist that's a true live human that integrates with that clinic, goes and meets the clinic staff a few times at the beginning, and then largely provides virtual support back to that primary care practice. They become the individual that's monitoring the platform, they're messaging with the patients, they're changing assessments, they're pinning content, but they're doing it all under the direction of the PCP, just as if they were there in person in a true behavioral health integration model. The second part that we bring in terms of that true human connection is we have a 24/7, 365 care coordination group that we work with. So once somebody is identified as really struggling and needing additional mental health care, they enter into that care coordination pathway, they get short-term coaching, and that care coordinator works to connect them to long-term care. We sit at the left side of the funnel of the mental health care ecosystem, so we identify people, those that can be managed within primary care, we help with that management. And then for the folks that need to be connected, we do the care coordination and then hand off to other companies that provide the long-term care.
So it's a combination of human resources, change management within these practices, technology, and also direct contact with the user, the patient in this case, to sort of give them a constant companion and resources. It's a lot of different things that you're doing there. Is this going to make it more accessible for more people and more functional in terms of the HCPs that are delivering the care, that they're going to be able to use this more efficiently?
Sure. I mean, that is certainly my hope. I mean, I often say to my team, I'm still a practicing physician, I'm a neuropsychiatrist, I take care of patients every single week. And my goal is that by the time a patient walks through the door to see me, I want that to be a patient that needs my level of expertise. And I therefore want the patients that are being seen in primary care to be the right people that can get care at that level. And so if we're making the referral network take care of those folks that actually need that specialty care, then we're giving access to more individuals in that way, and then we're helping the people that are seeing maybe a primary care provider but nobody else start to get access to the mental health resources that they need as well. In terms of a broader solution, I also think about this as a way to efficiently and effectively get care to people that do have a PCP or do have those resources, therefore allowing devotion of resources to other individuals that may not even be lucky enough to have a PCP to begin with.
Mental health is a huge, very broad area. I mean, you can't just say mental health and have a clear understanding about what part you're talking about. So are there particular areas within mental health where you find your patients or your PCPs that you're working with are most able to put this to work?
I really appreciate you asking that. Yeah, our ideal patient is really the individual with mild to moderate symptoms of depression, anxiety, stress, burnout, etc.
So 99% of the population.
And that's where we're starting. Yeah, I mean, if we can get those people the care that they need, 85% of antidepressants are prescribed in primary care. Some of those, I'm sure, are for people with major depressive disorder. Some of them probably aren't. But at the end of the day, that's where the care is being delivered. And if we can help that care be efficient, effective, appropriate, then we are becoming part of the solution. We've started expanding out into the chronic pain space as well. Not for management of the pain itself necessarily, but for management of depression and anxiety, which is a common comorbidity in individuals that are struggling with that. And we also are lucky enough to be starting to expand into women's health as well, partnering with OBGYNs and other people that are seeing those patients. They often become the equivalent of a primary care provider for some women, and we want to make sure that they have the resources as well.
Well, I could also imagine there's applications in acid reflux or IBD with the mind-gut connection.
Yep.
And being able to use this as a tool to be able to give better insights, so it's not just proton pump inhibitor you're prescribing, but actually some mental health resources to help people better deal with their symptoms that's troubling them.
Yeah, absolutely. And PCPs really, the folks that we're selling to, they really connect with that idea as well. We've recently started selling to risk-bearing entities as well. We just partnered with our first ACO. And so as we're going out to those different value-based care entities or risk-bearing entities, we really have gone above and beyond. We partnered with a healthcare economist to be able to show through better treatment of mental health conditions, how are you influencing the other chronic diseases within your network, within your system. And the numbers don't lie. It makes a huge difference if those conditions are treated properly.
What has you excited from where we are now to where you're going in the future?
Yeah, thanks for asking that. I think we are at a point right now where our growth is really accelerating over the last several months. The fact that we're all here without a mask on and everybody is happy and healthy is a great step in the right direction for us starting to get reconnected with even just care providers and people getting the care that they need. I'm incredibly excited about the opportunities we have in the value-based care space, in the ACO space, really allowing us to take this product that we spend so much time on and amplify the number of people that we're reaching. Those organizations, they have care management already, they have behavioral health specialists. We can really fit right in there and give them a way to remotely and virtually provide some of this care.
Great.
And do it in a way that they're helping.
Where do people find out more?
rosehealth.com is our website. My email is drmatt@rosehealth.com, and anybody should feel free to reach out.
Excellent. Thanks so much, Dr. Peters.
Thanks for talking with me.